I'll try to concise it in 15 minutes. So for centuries, medicine has been concentrating on treating diseases. But today, we are asking a deeper question. Can we extend human life to beyond 120 years? So today, so despite the extraordinary advances, human lifespan has barely moved in the last few decades. So the longest lived human being has been Jean Kelmet, who lived up to 122 years. But the global average has been around 73 years. So what has been the limit here? The biological limit is the physiological resilience loss. With aging, there is a decrease in the physiological resilience. So how do we decrease this gap is what we're looking into. Can we do it with functional medicine and regenerative medicine? Can we reduce the gap from the global average of 73 years to 120 years potential? Yes, we can. So that is why we are learning about regenerative medicine and functional medicine today. Why regenerative medicine? So chronic diseases are mostly concentrating on underlying tissue degeneration, whereas in conventional medicine, what do? Is we manage these slow decline and we give a palliative care. In case of regenerative medicine, there is restoration of this biological structure and function, but not just suppressing the symptoms. So what is regenerative medicine? It's a branch of medicine that develops methods to regrow, repair, and replace damaged or diseased cells, organs, and tissues. It is not one therapy, it is a consortium of biological therapies. But the major regenerative medicine therapies are stem cell therapy, gene therapy, tissue engineering, and biologics. What is the primary outcome towards doing these therapies? So it is repair damage, like in case of, if we take examples, it helps in healing the structural injury, not just forming a scar, but reforming the function of the tissue. Like in case of cartilage in osteoarthritis, the myocardium in case of post-MI, neural tissue with post-stroke. And it also helps in replacing the function or restoring the lost physiological function, like stem cell replacement through cell transplantations. And it also helps in reprogramming aging by resetting the epigenetic clock to a younger cellular state. But what is about longevity science? It is redefining the purpose of regeneration. So why from regeneration I've jumped to longevity science? So I'm going to tell you how regeneration, longevity, and functional medicine all together will help us extend the human lifespan. So longevity science mainly concentrates on the hallmarks of aging, where genomic instability, telomere attrition, epigenetic alterations, mitochondrial dysfunction, chronic inflammation, and stem cell exhaustion, all these together, cellular senescence, leads to aging. So we concentrate on reducing these aging factors, and the period of illness and disability is reduced to the very end of life, maximizing healthy years. So functional medicine is the soil for this, where you optimize the biological terrain. The main biological hinders are mitochondrial dysfunction, insulin resistance, chronic inflammation, nutrient deficiencies, and dysbiosis. When you try to regenerate in a dysbiotic, or when you try to regenerate in an unoptimized state of biological terrain, the success rate is very less. So before you regenerate, you have to optimize the biological terrain. So functional medicine prepares the soil so that the seeds can take the root and flourish. So what is precision medicine? Like I spoke to you, Jess, regenerative medicine, longevity science, and functional medicine together leads to precision regeneration. It is a mix of biology, technology, and systems medicine. It focuses on repairing damaged tissue and restoring structural integrity, and it also optimizes the biological terrain to create an environment for healing, as well as it also targets the fundamental mechanisms of aging to delay biological decline. So let's go through the breakthroughs in regenerative medicine which we have seen from the recent times. So there has been pluripotent stem cell therapeutics that have been demonstrated to restore the capability of vision and effectively cure type 1 diabetes in preclinical models, and AI foundation models which have cracked the code of stem cell differentiation predictability, enabling more consistent and safer therapeutic outcomes. And there have been mesenchymal stem cell therapies confirmed as effective tools for combating chronic systemic inflammations at the cellular source. And the personalization has been made more effective with AI and genetically matched, reducing the rejection risk, making regenerative interventions viable for broader population. And what has changed over the past 5 years is not only the efficacy, but the predictability, the safety, and the precision have also increased over the last 5 years. Coming to AlphaFold 3. What is AlphaFold 3? So till now, I was talking about regenerative medicine and functional and longevity science. So what is AlphaFold 3? It is an AI-built technology which helps in transforming drug discoveries, and it predicts the protein ligand, protein DNA, and protein RNA complexes. It's the first AI system that has been developed by Google DeepMinds, and it is being used most commonly with the pharmaceutical companies presently, and it also helps in the production of longevity drugs which act 10 to 100 times, enabling research to identify therapeutic targets in days rather than taking longer duration. So this technology has its clinical implications other than pharmaceutical applications. Those are in chemical modification, which is crucial for disease understanding and drug design, and in changing the protein, in identifying the protein behavior change with ligand presence, and also it enables targeted designs for regenerative medicine application. Though it has its own limitations too, like it struggles with large confrontational changes during binding. It cannot be reliably ranked during binding affinity or predict drug potency, and it requires pairing with physical-based validation methods. AlphaFold 3 informs upstream structural biology, but downstream validation remains essential still. Despite limitations, represents a transformative advancement in computational biology. So now we have seen about AlphaFold 3. Next is the CRISPR method. CRISPR is a tool that is developed for correcting the disease causing mutations permanently at a DNA level. So it is a molecular scissoring technology that has been developed, and it is FDA approved in 2023 for sickle cell disease treatment. And there are a lot of trials going on globally, which are more than 100 plus, and it helps in editing or enables knockouts, knock-ins, and base editing at the DNA level. Its applications in regeneration are like cell fate control, stem cells for tissue engineering, and HLA modification, which modifies immune profile to prevent transplant rejection. Other than disease treatments like in cystic fibrosis, osteogenesis imperfecta, and in congenital diseases. So I'll just give a brief about the organ-specific regeneration. the organ-specific regenerations coming to cardiac, there has been a study called Prevent TAHA 8, in which they have seen Wharton jelly mesenchymal stem cells demonstrating immunomodulation and angiogenesis. It improved the left ventricular function in heart failure patients, and it also, this study was followed up for 3 years, and they have seen that the precipitation of heart failure admissions have reduced a lot. And another study which is published in Nature, which we have seen, is the pluripotent stem cells. That was first cardiomyocyte transplantation done in humans. There were no tumors, there were no adverse events in the clinical trial. It was a phase 1 and phase 2 trial done in Japan, and it demonstrated survival and functional integration in human hearts. Next, coming to the neural system, the brain regeneration, neurodegenerative diseases have been increasing of late with post-COVID and autoimmune structure. So Parkinson's disease has been the most studied in this, and they have seen that stem cell therapy derived dopaminergic neurons were transplanted in phase 1 and phase 2 trials. They have seen that cells survived and it produced dopamines in human brain. There was no tumor formation in this too, and PET imaging confirmed functional integration. The other applications of this were in multiple sclerosis, exome delivery, which crossed the blood-brain barrier. CRISPR was used for amyloidosis, and they were used for retinal diseases also. So with liver regenerative therapies also, we have seen in phase 1 trials in mesenchymal stem cell replacement, which helped in chronic liver diseases or cirrhosis. Retinal regeneration has been proved successful with ex vivo, but there have not been any human cells yet done, human studies, but ex vivo cell-based therapies have been effective in this. Stem cell replacements with retina also. There was a Vincosen trial which helped in retinitis pigmentosa treatment, which also was proven successful. So what are the breakthroughs in stem cell therapy? The first stem cell therapy, which was approved for sickle cell leukemia, was approved in 2023 December, and there are still ongoing 1,200 plus studies in ophthalmology, neurology, and oncology with stem cells and exome therapy. In India, there has been a study related to Berger's disease. That is, there has been a regeneration of the toe. There have been regeneration of the toe for critical limb ischemia, and it was the first approved stem cell therapy in India in 2016. Phase 4 trials demonstrated significant improvement in rest pain and ulcer healing and regrowth of the toe muscle. Mesenchymal therapies have been used for osteoarthritis, diabetes foot, and several other trials have been going on with relation to Crohn's, fistulas, and atherosclerosis. And CAR T cell therapy. This is one of which India has achieved, and the Honorable President has launched it because we have, compared to the Western world, we are performing it at a very low cost. And this therapy is used mainly in oncology, and significantly lower cost is being used here. It is an advanced cellular therapy associated with broader patient population. Exome therapies are extracellular vesicles carrying proteins, RNA, and growth factors. These therapies have been much safer than the stem cell therapies. There's no tumorigenicity in it, and uncontrolled growth risk versus uncontrolled growth risk is less in exome therapy when compared to stem cell therapy. At AIG, there have been 3 to 4 studies that have been published with regard to regenerative medicine, and one of that was autologous islet transplantation, which preserves endocrine function post-pancreatectomy. And this was the first case series which were published from India in the Indian Journal of gastroenterology. And there are other studies with regard to liver cirrhosis with autologous CD34 stem cell infusion and also hemopoietic stem cells and mesenchymal cell therapy, which demonstrated feasible and safe infusion, but its effect was waning over time. So what is available to us now? CRISPR, stem cell, and SGLT2 inhibitors, which increase the telomere length, and NAD+ and senolytics, which help in aging interventions. So these are the available therapies for us for regeneration as well as for longevity. As we gain the power of rewriting the code of life, we bear the responsibility to ensure safety, efficacy, and ethical application. So we must be careful. Innovation must walk with ethics. This is about the next 5 years. What we may see is lab-grown organs, epigenetic trials, CRISPR in Alzheimer's and diabetes, and a combination therapies which may help in preventing early aging. Personalized medicine, in situ regeneration, AI drugs, and reprogramming together will be seen in the near future for 10 to 15 years. Go ahead. So before expanding health span to 100 to 120 years, breaking 120 years barrier requires a fundamental new interventions addressing resilience loss. So level 2 therapies could help us address this by 30 to 40 years of healthy years by 2040 and 2050. 150 years plus is possible by reducing the physiological resilience. And what are the factors that are seen to reduce the physiological resilience? The biomarkers for tracking biological age, the epigenetic clock markers, the telomere length, the metabolic markers, and the inflammatory markers. And lifestyle, we're talking about a lot of advances now. The lifestyle plays a major role, and it is the foundation for regeneration. Nutrition, exercise, sleep, and stress management play a critical role in regeneration. The key published evidences, you can take a look at them from Nature Journal, BMJ, and Stem Cell Transplant Medicine Group. So the future of longevity medicine is integration of alpha-fold 3, CRISPR, stem cell, exome therapies, and metabolic interventions that will create a new paradigm in healthcare focused on cellular regeneration and disease prevention. The future of, like I said, the tool to expand health span and compress morbidity are here. The question is not whether regenerative medicine will transform aging, but how quickly will we make it accessible to all? Advanced therapies are emerging to restore function, not just manage symptoms. The take-home message is medicine is shifting from treating diseases to engineering health, function, and longevity. Thank you so much.
Thank you, Dr. Anusha. It's very interesting and fascinating topic. All of you must have heard. In fact, when our scientific committee was discussing, we fixed the topics and then we were trying to search the speakers. So we couldn't find anybody. So I asked Dr. Rakesh to suggest a name. Thanks to Rakesh and thanks for you from Hyderabad. It's a wonderful topic, and definitely it's. I mean, the other day in the meeting with Putin, Kim, and Ping, they were thinking of living up to 150 years. If Trump also lives for another 150 years, then you can imagine how the world is going to be. But anyhow, keeping it aside, now it's now said that the skin trophoblast, where induced pluripotent stem cells, this has the embryonic cell memory, and by using your Yamanaka factors, where you can culture cells, so skin is very, very valuable organ in your body for future regeneration. It is less complex, easily, available. And then what is the status and what are you, because you can grow any organ